Hi everyone. We apologize, our Facebook Live event was having some technical difficulties. So just to make sure you get this important messaging, we are going to record it and post it to our Facebook page. If you have any questions, please feel free just to comment, and somebody from the dental program, either Lisa or myself, will get back to you with some answers to your questions. A couple people were able to sneak some questions in before our technical difficulties started, so we will answer those questions in the very least. So yes, if you didn't hear, my name is Stefanie and I'm a certified dental assistant here at Niagara Region Public Health.
My name is Lisa and I'm a registered dental hygienist here as well at Niagara Region Public Health. Today we're going to go over a few helpful tips to get you back on track to visiting a dentist and providing you with some information on what to expect when you return back to the dental office. I'd like to let you know that Stefanie and I are not wearing masks because we are separated by a barrier. So again, if you have any questions, please put them in the chat and someone from our dental team will get back to you with an answer.
So first and foremost, we're gonna talk about why teeth are important. So what we all love to do, we all love to eat. So of course our teeth help us to eat, and each tooth will play a different role. Some teeth are responsible for ripping food, while other teeth are responsible for grinding. And the next would be talking, of course, making different sounds as we're talking, and showing expressions such as smiling. Smile is probably one of the warmest expressions we can have, and we need our teeth to smile. So teeth are also really important at any age. Baby teeth are important, just as important as adult teeth are, and they really do contribute to our overall health. Poor dental health in general can cause your child to have struggles with eating, with sleeping, even with some learning problems. It can be really disruptive to their learning, and that will hinder their overall growth and development.
As we all know, the pandemic has changed many of our day-to-day lives. Dental offices were closed, but have been reopened for some time now. Many of your children may have missed the regular cleaning or filling appointments. It is important to connect with your dental office to get your children back on schedule for regular checkups, or if they've missed any appointments, to get those looked after. Keep in mind that some dental offices may still be playing a bit of catch up, so please be patient with them and they will get you in as soon as they can. Many children spent most of their time at home this past year. With all the changes, many regular routines at home were interrupted. Work on establishing a routine at home with your children. Brushing, flossing, and healthy snacks are all things we're going to go over today. With more time at home, children have been snacking and grazing more. This can have negative implications on your children's teeth, especially when their routine brushing and flossing has been thrown a bit off. This again is why it is important to get our kids back on brushing and flossing schedules at home, and why it is important to go visit the dentist or your dental hygienist. In the next couple of slides, we are going to go over brushing and flossing and some healthy snacks.
So like Lisa mentioned, it's really important to establish an oral hygiene routine. There are 4 important steps in doing so. And the first one, like Lisa said, is our dental appointments. So it's really important to get back on track with routine care and getting in for any appointments you may have missed during the pandemic. If you do not have dental coverage, we are going to go over some options for you later on in our presentation, just about some coverage that may work for your family, for your children, to get them to the dental appointment, to get them to the dentist. So the next 2 things are brushing and flossing. So a little phrase we use for brushing that's really good for the kids to remember is 2 for 2 is what you do. So we encourage brushing 2 times a day, in morning after breakfast, and at nighttime before bed. So after dinner, after their nighttime snack, right before bed, and we just want to make sure we're brushing with a fluoridated toothpaste, and Lisa will go over toothpaste in the next slide. And then of course flossing. So flossing should be right away part of their regular routine, something that they do every night, we suggest. And last but not least, a healthy diet, which includes both meal times and snacking. And in a couple slides, let's go over brushing and flossing first. And then in a couple slides, we'll talk about some healthy options for your kids' teeth.
So here in this image, it shows you just about how much toothpaste someone should be using on their toothbrush. There is no need to use a large amount of toothpaste. You don't have to load your toothbrush up with lots of toothpaste, because really that just all gets wasted. So for a school-aged child or even an adult, we say the size of a pea is best to be used. Just enough fluoridated toothpaste to get the job done. As well, you want to be using a soft toothbrush all the time, and not a really large toothbrush. Actually, if you use a smaller toothbrush, it allows you to get in those areas that are a little bit harder to reach. If you have a really large toothbrush, it might be hard to reach areas at the very back of the mouth. So now for brushing. We want, like Stefanie said, brushing 2 times a day for 2 minutes in the morning and before you go to bed. So I brought my model here with me, and we're just gonna go over brushing. So super important to try and create a pattern so that sticks with you and that habit is formed, and then you never miss any spots. So I like to start myself in the top left hand area of my mouth. So if you create a pattern, you're gonna work around the top teeth, all the way to the other side, then change your brush angle and go back on the inside, and then you're gonna follow and do the bottom teeth at the same time. So when you're brushing your teeth, you wanna make sure you're putting the toothbrush at about a 90-degree angle from the tooth and the gum. We want you to gently jiggle the bristles. We don't want you scrubbing back and forth, because that can be aggressive on the gum tissue. So a gentle jiggling motion, and then you want to sweep away the food and plaque debris off the teeth. So on the top teeth, we like to say the way the teeth grow. So on the top teeth, you sweep down. On the bottom teeth, you sweep up. So a jiggling motion overlapping your bristles so that you don't miss any spots. Now when it comes to the bottom, like I was saying, if you use a really, really large toothbrush, you can't get into those areas very well. So we suggest you turn the toothbrush on its side, work 1 tooth at a time, and you're going to lift the brush 1 at a time and clean all of those areas. Next, now we've done all the smooth surfaces of the teeth, we want to make sure we get all those grooves where the food tends to stick. So in those areas, the enamel is a little bit thicker, so we can do a little bit of scrubbing to get all of those grooves cleaned. Last but not least, our lovely tongue, which harbors lots of plaque and food particles. So when we're done all of that, we want to take our toothbrush and sweep across the tongue to remove any plaque or food debris that's on your tongue. So in regards to a toothbrush, we recommend changing your toothbrush 4 times a year, or like we say, every 3 months. Like with the season change, you change your toothbrush. Or of course, if you were sick, if you had a cold, you should change your toothbrush as well then, so you're not transferring the bacteria and continue to be sick. So that's brushing. So of course, the next thing we're going to talk about is dental floss, everybody's nemesis. Nobody likes to floss, but everybody needs to do it. So for adults, we encourage you to do it once a day, and children too. So with children, when children's teeth are developing, sometimes they're not close together. So the minute that 2 teeth start to touch for children, we would like you to start flossing their teeth. If they're young, parents can help, but if they're old enough, they can start using a floss pick like this. So there's regular dental floss or floss picks. So with the floss picks, you're going to go around all of the teeth once and then throw it out, likewise with dental floss. So flossing, we recommend doing flossing your teeth before bed. So flossing only needs to be done once a day, and if it's done before bed, that way you're going to bed with a nice clean mouth. The recommendation, we floss your teeth. That way it disrupts the plaque and the food debris. Then you brush it all away, give yourself a little rinse with some water, and off to bed you go. So we all want to do that and make sure that that gets done once a day.
And just to add to flossing and brushing, actually, I know with my daughter, it can be a struggle. It can be a struggle in general to brush and floss. A lot of parents, what they'll do is a face-to-face approach. So your child's in front of you, you ask them to open their mouth, and you're brushing this way, which can actually be very difficult. It's not very comfortable actually for both the parent and the child. So one of the things we recommend is if you can get your child to lay down on their bed, or maybe even your bed, because it could be higher, and put their head at the foot of the bed. Have them open their mouth really big and have them tilt their chin up. It's almost the same position a dental assistant, hygienist, or dentist would be in. And then you brush that way. It's a lot more comfortable. You can actually see a lot more, and you'll do a better job that way too.
I know for myself, when my girls were younger, I always had a chair in my bathroom.
Yep.
I would sit on the chair and have the girls sit on the floor and tip their head back, and it was easier for me to get in there.
Yep, for sure.
I also wanted to mention, when it comes to brushing, if we have any parents or grandparents that are taking care of little ones, we like to say, allow the child to brush their teeth first, and then mom or dad, grandma, grandpa, or older sibling can brush after, just to make sure that they're getting all of the areas and we're not missing any.
Of course. All right, so now we're going to talk about that last point, which is a healthy diet. So just as a healthy diet is important for our whole body, it's important for our mouth and our oral care. So we want to be making healthy choices and reducing the amount of sugar we are having. So sugar creates that acid on our teeth, which then will cause the cavities. You may also not realize that carbohydrates, they act the same way on our teeth. So they too will break down to that acid, which will also cause a cavity. So along with our brushing and flossing routine, the next important thing is picking those healthier meals and snacks and making sure, most importantly, that we're choosing drinks too. Children are going to ask more for pop. They're going to ask more for sugary drinks, juices, or maybe even energy drinks. And those are going to be just as harmful to our teeth as the selection of sugary or carbohydrates that we may be choosing for our snack. So we want to make sure that we are drinking water first and foremost, along with milk as well. And when children are going to be grazing more, of course, they're at home more, and they may want those snacks that are not great for their teeth, but let's try to encourage things like meats, cheeses, or nuts, which aren't going to be, they're not going to produce that acid as much as the carbohydrates or sugar will.
Veggies with dip.
Veggies with dip, yeah, there you go.
Crunchy foods are great too, because they kind of cleanse the mouth as well.
Yeah, and lots of water, because even if they do choose a snack that's maybe not ideal, but they're having that water that's flushing their mouth out, it is going to help with the situation as well. So foods to avoid, we say the 3 S's, and they are starchy, sticky, and sugary. So children tend to go towards beige food. So beige, white, crackers, pretzels, chips, breads. It's usually one of the things that they want first and foremost. And like I said, those are going to be carbohydrates that are going to turn into sugars or acid on our teeth. The next one would be the sticky foods, fruit roll-ups, fruit snacks sometimes. And even, I know for me, for my daughter, she takes a vitamin every single day, and finding a vitamin that wasn't chewable or sticky was actually really difficult. So of course it's important for them to have their vitamins if they're taking supplements as well, but just maybe try to get them to have that vitamin when they're going to be brushing soon after. And then sugary snacks, usually anything that comes in a package tends to have a lot of added sugar, as well as sports drinks like I mentioned before. And even be careful with hidden sugars. A lot of like those tubes of yogurts can have added sugars in it. A lot of snacks, a lot of juices. They'll say real fruit juice, but they still have added sugars. So just be really, really careful, and just read your labels and your nutrition ingredients, and just see what's in there and see if it's a good choice.
Just to add to that, we all love our sugary snacks and our cakes and our donuts. But with children or even for adults, great, indulge and enjoy, but it's a good habit to get into, to swish with a little bit of water afterwards, just to help start the neutralization process in your mouth.
Mm-hmm. Everything in moderation.
Yep. So like I mentioned before, dental offices are now open and seeing clients. If you have not made an appointment to see your dentist, now would be a good time to consider booking one. We want to review what to expect when you show up at the dental office. Things may look a little different. First, you may be asked to wait in your car until the room is ready for you. Waiting rooms now have far less chairs in there, and they are spaced 2 meters apart. The office may also ask you to come alone, or if you're coming with a young child, only to bring one parent with you. And this will allow for the amount of people allowed in the building at once, and they don't want the waiting rooms full of people. The next thing that you will may encounter is a COVID screening upon entering the building, which would also include having your temperature checked. During the entire time at the dental office, you will be required, like in all public buildings, to wear a mask. The only time that you will be able to take your mask down is during your procedure. Now, once you have made your way to the back procedural room, things might look a little different. Staff may look a little bit different. And these are the things that we're going to go over with you now. And Stefanie, we have some lovely pictures to go over with you to show you just how you're going to look.
So PPE, I feel like it's a key phrase right now, especially in the pandemic. So PPE stands for personal protective equipment. Dental offices always wore PPE, but they're a little bit more enhanced now. So you will always see dental office staff wearing either a surgical mask or an N95 respirator mask. You can't always tell the difference between the two, but rest assured, the dental professionals are choosing the mask according to procedure properly. You will also see every dentist, dental hygienist, or dental assistant wearing gloves. We're gonna pop some pictures up so you can see Lisa and I in our full gear. So we're wearing gloves, we're wearing a gown, a mask like I mentioned, eye protection, and as well a face shield. You may also see that staff choose to wear a cap, like a hair covering. It's just like a surgical cap that you would see on any one of our many medical shows on TV, but that's just an added layer of protection they may choose to wear. One of the things you may notice, parents, when you're booking your appointment, they may be booking differently and maybe not back-to-back appointments. We refer to that now as a fallow time. And simply put, a fallow time is the amount of time the clinic room or the treatment room is left unoccupied after an appointment. And the point of that is to let any contaminants in the air fall and settle so the dental staff can properly disinfect and clean them. You may also see that there's air purifiers in the clinic or treatment rooms, and this shortens that fallow time, and it also just overall adds to better air quality. So that wraps up our oral health recommendations, as well as kind of some of the changes you're gonna see while we're in this pandemic phase in the dental office. We're gonna just take a few minutes to quickly talk about some of the dental programs we have here at Niagara Region Public Health.
So the first one is Healthy Smiles Ontario, which is a province-funded program in Ontario, and it's for any child eligible from the ages of 17 years and under. And it covers you to go to a dentist of your choice for regular routine treatments. So if you need your teeth cleaned or if you have some fillings. If your child does have an emergency and you have any questions about Healthy Smiles Ontario, please call Niagara Region Public Health and we can help navigate that for you.
So some really, really exciting news for us. The Niagara Region Public Health dental clinics are reopening tomorrow, which is April 20th. And it's some really great news. A lot of parents are pretty familiar with our program. We generally have 4 fixed dental clinics as well as our mobile dental clinic. And right now we're going to do a slow progression to opening, and we're going to be seeing clients in our Niagara Falls location and our Welland location. And at those locations, we can offer dental assessments to check the eligibility for Healthy Smiles Ontario. We can also offer some cleanings, fluoride varnish treatments, dental sealants, as well as oral hygiene instruction and education for both your children and parents themselves. So once again, if you need any care, please don't ever hesitate to reach out to us for that.
So on the screen there is how you can reach out to us. So if you have any questions or if you have concerns about your child, you can reach out to us here at Public Health. So our phone number is posted there. Someone is available to answer your call from 8:30 to 4:30, Monday to Friday. You can also send us an email and one of the dental staff will get back to you with a response or give you a call if you provide your phone number. The other thing there on the screen is really exciting. So just a couple months ago, we launched live chat. So if you enter the Niagara Region website and search up dental, on the dental page, you will find a live chat button. And if you click on that, you'll have to fill out some information, some demographic information, and then you will be reached out by, or you will be connected with one of the dental staff, so a dental assistant or dental hygienist, and we are there available from 9:15 to 4:15 Monday to Friday to answer any of your questions. And as well, if your child maybe can't make it to one of our clinics and they have a dental emergency, we could also do virtual assessments using video calls and do an assessment online as well. So please feel free to call us. If you have any questions, we are available to answer them for you.
So now we have our dental question time. Unfortunately, because we're not live, we can't ask or answer any live questions, but we did get a few before we had some technical difficulties. So we're gonna address those. But once again, I would encourage anybody who has questions to either email us, call us, enter a chat like Lisa said, or just comment in this video section and one of us will reach back out to you to answer your question, or maybe we've already answered it.
Yeah, that's right. So first off, I do have a couple here.
Okay, go ahead.
One says, I don't have a dentist for my child to go and see. Can you help?
Of course. So the best way to be connected with a dentist or a dental home would be by word of mouth. So ask your family, your friends, your neighbors, people in your community where they go, and maybe be prepared with a couple questions. If you have some dental anxiety, ask how the dentist maybe handles that. Ask how they are with children. You could also just do a Google search to see which dentists are around your area if you want to kind of stay closer to home. Another option is the Royal College of Dental Surgeons of Ontario, so the RCDSO, will also have a listing of dentists in your area as well.
Yeah. So as well, Stephanie, just to add to that, it says, I don't have any dental coverage. What should I do?
Okay, so if your child is 17 years of age or under, please reach out to us. Healthy Smiles Ontario has a few umbrellas under it, but for the most part, we are able to offer your child some sort of dental coverage and dental treatment. So all of our contact information will be up, so just never hesitate to reach out to us, whether it's chat, email, or phone, and we will get you connected to some care for sure. Now, if you're 65 years of age or older, so any parents watching, if your parents or neighbors or relatives are 65 years of age or older, we also have the Ontario Senior Dental Care Program, and we are happy to connect you as well to information about that and to find out how you're eligible and how to enroll in that program. Which one are we on now, Lisa? Okay.
My children, yeah.
Okay, so my children used to have a screening. Oh, this is good for Lisa. So my children used to have a screening at their school and then have treatment on the dental bus, which is the mobile dental clinic, which Lisa is one of our mobile dental clinic members. So this parent is asking where they go now for treatment and will we be back in the schools?
So unfortunately, right now, the dental bus is not back on the road. We are in the midst of trying to get it up and running to abide by the COVID rules. So in the meantime, like Stephanie was saying, Tuesdays and Thursdays, we do have 2 clinics that are starting tomorrow. So please, again, reach out to our department. We can schedule you in. You could also do a virtual assessment through live chat. So those are 2 options. In regards to the schools, well, like all, the unknown. We're not sure when and at what point we'll be able to go back to the schools. But rest assured, once the bus is up and running, our website will have all of the locations that you will be able to access the care on the dental bus. And once we are back into the schools, I'm sure the schools will notify the students when the bus will be coming back. So let's keep our fingers crossed that we get there soon.
Okay.
So this one's Stephanie. It says, it's from Courtney. Hi, my 11-month-old has 8 teeth and currently working on her molars. We brush twice a day with a very small amount of fluoridated toothpaste, but she doesn't always cooperate. How do we know if we're doing a good enough job? Any tips, tricks, or tools to make brushing fun for a young toddler? Since you have a young toddler.
Yeah, I'll answer it. So my daughter's 3, and I mean, 11 months old seems like it was just yesterday, and all of a sudden she's over 3. But yeah, it can be difficult, and it also can be sometimes just exhausting to fight with them. So I find most success for some reason at bath time at night. So when I'm doing the nighttime brushing, I don't usually wait till she's out of the bath. I try to do it while she's in the bath. Maybe she's distracted and I can get the job done easier. I sing, and I'm not gonna break out into song right now. I know everybody would love to hear me sing. There are a couple songs that you can sing that kind of distracts them long enough that they'll open their mouth, and my daughter actually asked for me to sing now. She loves Paw Patrol, and I got her a Paw Patrol toothbrush, and just the fact that it's her favorite characters on those toothbrushes really helps. Also, I would say like there's some apps on your phone that have like fun timers that they could just kind of watch, and it just distracts them long enough so you could get that brushing done.
I was gonna say, if I can interrupt, Courtney,
yeah.
Don't beat yourself up if you don't get the perfect job every single time. If you're doing your little daughter's teeth morning and before bed, that is great in itself. So what you missed at breakfast, you're probably going to get at bedtime. So don't worry. Do as best as you can. We have all had fussy children, and we know. And sometimes you might miss one, but that's okay. Before bed, you're going to get it again. Okay?
The fact that you're in there twice a day and you're trying, it's going to matter for your child's oral health. And not only that though, but if she's teething, they might just be more cranky. Their mouths are sore. So you may not be able to get in there as easy, and it's a phase of teething, and it will pass like a lot of phases too. And then maybe they won't be so cranky when you're brushing their teeth. They're sore.
And if she has spots that have just the gum tissue still there, no teeth have erupted, a warm washcloth just on your finger and massaging the gums, and that gets them very used to it as well, having stuff in there.
And Courtney, one of the good things for your child's age, being 11 months old, is every once in a while we call it lift the lip. So just her top lip here, just lift it up and make sure you're getting where her gums and her teeth meet, and make sure you're looking there for any irregularities. Seems to be where children's cavities will start first. So just take a look there. You also mentioned that you're using fluoridated toothpaste, and I know Lisa mentioned a pea-size amount for school-age children. For a child as young as yours, we just recommend a rice grain amount. You really don't need much at all for your child. There's one more question. Hold on. What are some cleaning protocols I should expect when going to the dentist? I'll answer.
Do you want to take the lead on that, Stephanie, the iPack girl?
I love my infection prevention and control. So rest assured, I know all this expanded and enhanced cleaning is really common. You're hearing a lot about it more now since the pandemic. But for dental professionals and dental offices, it was always standard. We always have a gold standard of cleaning, disinfecting, and sterilizing in the dental office. Regularly cleaning before every patient, in between every patient, sterilizing. It's all been something that dental offices have always done. They've always held themselves to a gold and a high standard. The things that you're going to notice that are different are the PPE, are those things like fallow times and less traffic in the dental office, and maybe like not being able to wait in a waiting room. But just have full confidence in your dental staff that they're following their college's recommendations for cleaning, disinfecting, and sterilizing.
That's right.
I don't think we have any more questions.
No more questions there. So
yeah, so we apologize for the technical difficulties we had earlier, and we hope this is beneficial to our audience. Of course, reach out to us. We can't say it enough because we don't ever want parents to sit and wonder, but give us a call the dental line directly, reach out to Niagara parents. They can connect you to us as well. We all work together here. We're all one big team, and we just want to make sure that your children are being taken care of to the best of our abilities, of course. Thank you, everyone.
Thanks for listening, everyone. Happy brushing.